Hi, I'm Dr. Robert Pruney, and I'm here with Christy Gamble, and we're going to ask her a few questions about her chiropractic care. First of all, Christy, can you tell me a little bit about your background?
Sure. I am a nurse. I've been a nurse for about 12.5 years and came to you guys initially because I work out a lot and I hurt myself at the gym. And as a result of the pain I was experiencing, although I'm a nurse, I'm not one that really enjoys taking medicine if I don't have to. And so I really felt like it was important to get to the root cause of why I was hurting. So that's how I came to see you initially.
Okay, great. How did you hear about us?
I actually heard about you from my trainer, and they had suggested that, I come see you because you were good at incorporating, sports medicine along with, the chiropractic care. And so I came with great skepticism and trepidation. Because,
not unusual for the medical field,
right,
yes.
Right, exactly. Because essentially, with my background in nursing, you're not always taught to embrace other alternative forms of medicine. I think medicine as a whole is beginning to embrace that a little bit more.
And your nursing background is more unique than just typical nursing. Can you tell us what it is that you do as a nurse, what your particular field is?
Currently, are you speaking currently?
Yeah, currently.
Yeah, currently, yes. I work for a pharmaceutical company, ironically.
Right.
And I work in the neurology field.
Okay, neurology specifically.
Exactly.
So really, you have a pretty good understanding of what it is that we do, and that's difficult for most people to understand, is that we're not really bone doctors. Right. We're actually, what kind of doctors?
Yeah, you work with the neurological system.
Right.
Exactly.
So that makes it easier for you to understand, and you can see the connections that are there.
Certainly.
What benefits do you think you've gained from not only the chiropractic care, but the specific type of exercises that we do here, in the flex building, the stretching, and resistance?
Wow, that's a big encompassing question, and that I think the specific benefit that I've gained is just understanding that everything is related, first of all, and that your back hurting really is not just a bone issue,
Oh, wow.
And
Good,
it's not just a ibuprofen issue, or something of that nature. That you can actually begin to work on the nerves to actually get them to cooperate with your muscular system, and honestly, just created a better state of health for me in general. I mean, less tension in my back and my shoulders, and better posture, and I think a better sense of, like, when I work out, which is something I enjoy to do as well, just for my health, a sense of understanding, the movements better and being able to have proper form.
Right. If there was somebody that was sitting on the fence about coming in to get an adjustment, or they might have some kind of fear, what advice could you give them?
That it's not just about bone cracking. I mean, I think people just kind of hear that and they think, oh God, I don't want that. But that it's actually for a greater state of wellness for your whole self, not just one piece of it. So you're really, I think, having a more holistic approach in terms of the patients that you treat.
So you would say, just do it?
Yeah, absolutely. Okay. Absolutely.
Well, I want to thank you for your help in your interview, and this is going to help a lot of people out there, I'm sure.